However, current global circumstances suggest it's likely that this virus will cause a pandemic. In that case, risk assessment would be different, and new strategies tailored to local circumstances would need to be implemented to blunt the impact of the disease and further slow the spread of the virus. What these interventions would look like at the community level will vary depending on local conditions and on the emerging information about how severe the virus may be. Now, it's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will become infected and how many of those will develop severe or more complicated disease.
You might recall I had mentioned that from the time we had available sequence, we would hope to be in clinical trials within 2 to 3 months. And I said, barring any glitches, that would be the fastest ever in any vaccine that we've gone from the identification of a pathogen to putting it into a human in a phase 1 trial. Well, I'm happy to report to you this afternoon that we are on time at least, and maybe even a little better. The gene has been expressed in the platform, in this case a messenger RNA. The material has been produced. It's been put into mice, it's immunogenic, and it's now getting ready to go through the regulatory issues of getting it to go. So I would project that we would be in a human trial, I would say within a month and a half, and I had thought that maybe cut a week or so off. Again, hopefully no further glitches. Now the thing we need to understand, because we want to make sure people don't get confused, that getting a vaccine into a phase 1 trial within a 3-month period, you need at least 3 to 4 months to determine if it's safe and whether it induces the kind of response that you would predict would be protective. Once you do that, you graduate to a much larger trial. The N of the number of people in the phase 1 trial is 45. When you go to a phase 2 trial, you're talking about hundreds, if not thousands of individuals to determine efficacy. That is a trial that we would have to conduct in those countries and those areas where there's active transmission. That itself, even at rocket speed, would take at least an additional 6 to 8 months. So when you're talking about the availability of a vaccine, even to scale it up, you're talking about a year to a year and a half. Right now, depending upon what the denominator is, the lethality for the current coronavirus infection is somewhere around 2%. You know, if you do different studies that are coming out, 2.5, 2.6, 1.9, about 2%. If you compare it to the SARS outbreak, it was 9 to 10%. MERS was 36%. And then if you go through the history of pandemic influenzas, depending upon the year, anywhere from 0.5, 0.6%. When you get to the 1918, it's 1.5 to 2%.